We are Group 1, and our topic is childhood apraxia of speech, and I'm Taylor Justice.
I'm Felicia Cox.
I'm Anna Moses.
I'm Bree Zalewski.
All right. The ASHA definition of childhood apraxia of speech, it's a motor speech disorder, and children with childhood apraxia have problems saying sounds, syllables, and words. And it's not because of muscle weakness or paralysis. The brain has problems planning to move the body parts such as lips, jaw, and tongue needed for speech. And the child knows what he or she wants to say, but his or her brain has difficulty coordinating the muscle movements necessary to say those words. And a little bit about the controversy of childhood apraxia of speech is currently there are no research findings that provide support for the core problem or its diagnostic label. And there's no agreed upon assessment tool in the field to make the diagnosis, but in our research we did find a few assessments that do help. And the three types of evidence needed for diagnostic classification is 1, most convincing evidence, which is a clear biological finding of the disorder. And then 2, less convincing but still useful source of evidence, which is a set of behavioral assessment findings that discriminate children with childhood apraxia from children with severe phonological disorders or dysarthria. And then the third type of research finding would be tied to treatment outcomes for children with suspected childhood apraxia of speech.
Okay, we're going to get a little bit into the etiology of childhood apraxia of speech. And for the most part, the cause is unknown. Some possible causes do include genetic disorders or syndromes or stroke or brain injury. And just some interesting facts about this disorder, about 86% of children diagnosed with childhood apraxia of speech have at least one family member that has a language or speech disorder. And about 75% of these cases of childhood apraxia of speech are misdiagnosed, oftentimes by neurologists rather than the speech-language pathologist diagnosis. Muscle weakness or paralysis is not to blame for this disorder. For the children who have troubles with their syllables, sounds, and words, like Taylor touched on, the brain doesn't allow the message to be received to the muscles to produce the correct speech. And so isolated exercises do not intended to strengthen the muscles will not help improve the child's speech, because once again it's a disorder of coordination rather than strength. And children don't simply just grow out of this disorder. There is no permanent cure for it. Children won't make any progress without any treatment, but with intensive intervention, significant progress can be made. And another little fun fact, apraxia of speech is known as the tangled tongue. Childhood apraxia of speech occurs in 3 conditions that we have listed here. The first condition is neurological impairment, and this is caused by an infection, an illness, or an injury either before or after birth. It could be due to a random abnormality or glitch in fetal development. The second condition is complex neurodevelopmental disorders, and this is where this disorder coexists with another disorder, such as autism, Fragile X syndrome, galactosemia, some forms of epilepsy, or chromosomal translocations with duplications or deletions of the chromosome during fetal development. The third type of condition is the idiopathic speech disorder, and with this disorder, the origin is unknown. We don't understand why the child has the symptoms that it does, and children don't show any observable neurological abnormalities or any easily observed neurodevelopmental conditions.
Alright, and then I did the signs and symptoms of childhood apraxia, and I'm just going to name up a few characteristics. And then the first one is in very young children, the child does not coo or babble as an infant, produces first words late, first words maybe missing some sounds, utilizes only a few consonants and vowel sounds. And then in an older child, they make inconsistent sound errors, has difficulty imitating speech, but imitated speech is more accurate, experiences more difficulty speaking when he or she is anxious, and is hard to understand, especially for unfamiliar listener. And then other potential problems, weaknesses of the lips, tongue, and jaw, a delayed speech development, and has difficulty with fine motor movement, also coordination such as cutting, coloring, and writing. And then I found this chart right here. It's a childhood apraxia speech checklist, and we found it off of a website, apraxiadallas.com. And then there's a few characteristics on here, such as severely delayed development, language, comprehensive, superior to language production. And then when the child presents this, the SLP will mark 1, and if the child does not present this characteristic, they will put a 0.
Okay, I did a little bit more research for assessments, and with this disorder, it deals with the oral motor, where the child is using their lips, their tongue, things of that nature. The SLP will have to examine the oral facial muscles to see if there's weakness or strength in them. With this disorder, children have no direct impairment of speech, but unless it's a child with Down syndrome. There's low muscle tone and often difficulty with movement involving feeding, eating, and swallowing. In the beginning, before all of this begins to take place, was one step I forgot, is that we have to do our case study and case history to make sure that the child has been diagnosed properly and that we know where to begin. There are 2 types of apraxia. You have oral apraxia and you have limb. Deals with the weakness in the, like I said, the orofacial, and the weakness in the upper body movement of muscles. Some children have difficulty with articulation, phonology, and oral motor skills. There are 3 types of testing that are used to diagnose a child with childhood apraxia. You have the Kaufman speech praxis testing for children, the Apraxia profile, the verbal motor production assessment for children. SLP will look at appropriate treatment methods for child development of speech. Therapy needs to be frequently and implement home practices also in it. Therapy focuses on the length and complexity of sound combinations, whether it starts with letter sounds or syllables. Techniques that can be used to help with treatment go along with oral motor approaches, phonemic and articulation approaches, verbal cueing, visual tactics, prompting, melodic annotation, I'm skipping this word, shaping approaching, where you break down a word and start with the phoneme, and then you blend it together into a syllable.
And then here's a few speech-language pathology strategies that you can use when your client has childhood apraxia of speech. You can teach the child about the sounds. And then starting from there, you can explain the rules when the child uses the different sounds in the words. And then encourage the child to imitate sounds, syllables, and words. And use gestures, pictures, or touch specific points on the face or neck to help the child make the correct sound or sequence of sounds. And introduce alternate communication. There's communication boards, there's keyword signings, and also there's voice output devices. So those are a few techniques that you can use as an SLP, and that is our presentation on childhood apraxia of speech.
Here's a close-up of our board of childhood apraxia of speech. We're going to start over here with the etiology, the 3 conditions, some pictures of therapy, the checklist that Breed touched on, the definition of childhood apraxia of speech, some signs and symptoms, why it's controversial, the diagnosis, some speech pathology strategies. Here's some about the assessment, about some formal testing, some treatment options, and then our references.